Alright, so here we are. I'm going to kind of share what I call a dual point touch or dual point release. For sake of camera shooting, I'm going to be standing on the opposite side of what I would normally do. Normally I would stand on the same side of the muscle group or tissue that I'm working, but for you guys to see it better, I'm going to stand on this side of the camera but reach over the patient. Don't do that, but for camera purposes that's what we're going to do. We talked about trigger points. You can have your primary trigger point, then you'll have a cluster trigger points, and you can have satellite trigger points, you can have referred pain syndromes. What I want to talk about is, if you have your primary trigger point, just say we have one in the lower glute or the piriformis, we have a primary trigger point. Well, we know you can have some referred pain patterns down along the different pathways, even up, okay? So just say that you find a trigger point, you're working along and you get one of the 3 G's, or you feel the palpable tenderness, the nodule, and that's the trigger point, and you've done your stretch like we did earlier, like we showed you. Another thing you can do is work directly on the trigger point, but also feel the surrounding tissue. Hit the house, but check the neighborhood. You hit the house, you check the neighborhood where the peripheral ones will show up. And you can just do a broad contact on the peripheral tissue, and you can feel tautness and tenderness. So how you know if you got this really released is you're feeling in the surrounding tissues. As you're working the trigger point, you can also feel the surrounding tissue, the neighborhood. When you hit the house, the neighborhood should also release and become more flaccid as well. So that's how you know you did your job on the trigger point. Same thing as like if you had the quadratus, and we have the charts. You guys will be able to download some of the charts, the slides. So if you have a deep quadratus muscle that has some trigger points in it. Remember, some of the referred pain was up under the ab. Now over here, it was up under the ab, so you can put your hand on the ab, on the rectus muscle. As you're working the trigger point here, you can also feel some of the tissue release in the front. It's called referred patterns, okay? That's the dual point trigger point method that we use sometimes in our clinic. So, and you can apply that from the calves all the way up to the neck muscles, to the extensors in the hands, the fingers, the digits. You can apply that to any muscle group. You got 2 hands, it only takes one to work a main trigger point. Use the other to palpate the satellite areas. Makes a huge difference. Christina, while we got the camera rolling, instead of stopping and doing another film, can you turn around and have your feet hanging off the end here? And I have Dr. Rogers behind the camera there. Go ahead and lay on your tummy if you would. Are we able to see the feet okay? One of the things that we also do is, come on down a little bit, is to stretch the calf muscle. I think this is a great way to stretch it that's easy on the practitioner, okay? What we'll do, we'll have the calf in neutral, foot's neutrally sitting down, but what we do, remember, if the person has a fallen arch, their foot is going to be rotated inward, right? So chances are they're going to be having a lot more big toe off pressing, which is going to affect more the inside of the calf muscle. So you're probably going to be finding more trigger points and referred pain patterns on the inside. If they have high arches or have the more propensity to cause the rolling calf or the rolling leg and ankle syndromes, then you're going to be having more trigger points and tight fascial tissue on the outside. So you can always watch the patient walk. If not, check their shoes when they come in. You can see wear patterns. But overall, when you're working the calf muscles, one of the things that I like to do is stretch at the same time I'm working them. An easy way to do this is to put your thigh on the toes, start at the bottom of the calf, at the proximal, or at the distal end of the calf, and as you stroke upward or work upward, you actually bring your leg forward and stretch the calf muscle at the same time. You can grip and work it up as you stretch, and you can work it in a pumping mechanism. Same thing with trigger points. If you isolate a trigger point, you can hold the house, and you work the neighborhood, feeling the tissue at the same time you're working the calf. So you're actually holding the trigger point and you're working it through passively. The key thing with any of the working things when you're working with the trigger points or referred pain is to do it passively. The muscle that has a trigger point in it or a cluster of trigger points is already in a semi-contracted state. So you don't want to contract it more unless you absolutely have to. Try to work it passively. If it doesn't work out then you can go to the active release technique. Hope that helps. Some more tips will be coming your way. Thanks.